Hi, this is Teri Javier, and I did my research paper over Charcot Marie Tooth, or CMT. It was first kind of described in 1886 by the three scientists, Jean Martin Charcot, Pierre Marie, and Howard Henry Tooth. That's why it's called Charcot Marie Tooth. It is a nerve disease, and it affects the peripheral nerves. It's a genetic disorder that can cause the myelin sheath, which is a protective covering around the axon, to not be developed or not be developed properly, or it can affect the axon itself. So the muscles don't get proper information from the brain and they can't relay proper information. There's no cure for it. There's no specific medication. It is a progressive disease. Some of the signs and symptoms are muscle weakness and atrophy in the lower legs and the hands. You can have nerve pain. You can have pes cavus, which is a high arch. They lose a lot of dexterity and fine motor skills. One of the hallmark symptoms of Charcot Marie Tooth is they call them stork legs or inverted champagne bottle legs, which is where they have a lot of muscle atrophy from the knee down, so they have really skinny legs from the knee down. So it kind of looks like stork legs or like a champagne bottle upside down. They can also, in rare cases, it can affect the diaphragm or muscles of the mouth, so they may have trouble talking and swallowing and breathing. CMT has a lot of different types of CMT, and different types of CMT can affect different ways, but most of them don't have a decreased life expectancy. They have a normal lifespan, even with the symptoms. There's one called Javier and Soda's disease, which affects infants, so their symptoms are going to be worse early on. The symptoms can be very delayed, and they're not like abrupt, and some people don't notice them, and some people may take decades for them to notice anything's wrong. But when they do, there's different ways it can be diagnosed, and it's most likely a nerve conduction test. They can do nerve biopsies or genetic testing also. They can also do the electromyography, where they stick the needles in the muscle, which tells them if the muscles or the nerves are reacting properly or getting the signal properly. Since there is no medication for it, pretty much the medical interventions are physical therapy, OT, and speech therapy. They can prescribe medications, but it's normally just for nerve pain, because some people experience nerve pain with this disorder. So it can be narcotics or anti-inflammatories, or if those don't work, they can be prescribed certain antidepressants that kind of help with pain. One thing with PT intervention, we can help with a lot of the muscle weakness, and because the muscle weakness in like the fine motor skills and stuff will affect their ADLs and how they take care of themselves, so we can help with that and help kind of delay some of the severity of the symptoms. But a precaution that needs to be taken, since they do have a lot of muscle atrophy and weakness, we need to not do high impact exercises, so really stick with low impact exercises and not to stretch too far because their muscles are fragile. And if they do have a component where they have breathing difficulties, not to do something where it's so high impact that it increases their breathing rate greatly. The disease is progressive, so it's going to get worse no matter what. And some complications from it can be sleep disorder, restless leg syndrome, pulmonary obstruction, or vocal cord dysfunction. And usually people do have some other type of comorbidities with this. I chose this disease because I had a great uncle that had CMT, and I lived with him and my aunt for a while. He was diagnosed with it when he was around 35, and my aunt said that his first kind of symptoms were he felt like he was walking through water, so his feet, he had a diminished sensation in his feet, and he had trouble walking. So he ended up with leg orthotics and forearm crutches to help with his walking. Even though he still had kind of these symptoms that made it harder for him to work, he was still able to take care of himself and work for about 10 more years. But by the time I lived with him in 2009 or 2007, he was already in an electric wheelchair. He could walk not very far. And he was on a lot of narcotics because he had a lot of nerve pain. And he was non-compliant with physical therapy. And so there wasn't really much the doctors could do, so they kept prescribing him more narcotics. My aunt actually had a lockbox for them because he would overtake his pain medication. So she had to be very diligent in making sure he didn't have enough where he could overdose. He also wasn't very nice, so he wasn't very appreciative of how much my aunt had to do for him because she was pretty much his caregiver. And it's very hard. This disease can be very debilitating to some people. So their caregivers can have a lot of like caregiver burnout and issues with taking care of them because they have to do a lot. So they kind of neglect their own needs. And my aunt did neglect a lot of her own needs and didn't do a lot of things for herself. My uncle ended up dying in 2009. He was in the hospital, and he had congestive heart failure and diabetes, and he died from congestive heart failure issues when he was around 57. But I could tell, like, after he passed away a while, she started to kind of take care of herself more and, realized she needed to focus on her own needs. So this disease can really greatly affect caregivers and family. So as physical therapists and physical therapy assistants, we really need to kind of work on helping them maintain their functional ability as long as they can, so that way they don't need as much help from caregivers, and it'll help keep their independence. And we can also do a lot of things for pain. I know nerve pain is a little bit harder to treat, but we can do some things for their pain so that way they're not on narcotic medicine. And I think as in the medical community, we need to kind of think more about how can we prolong their life? How can we increase the quality of life rather than, well, you hurt, so let's give you medication, or this is the problem, let's just give you medication. I think we need to kind of go to the source and the cause. And I think a lot of physical therapists and physical therapy assistants need to really pay attention to some of the signs and symptoms of this disease, because some people don't notice that they're having problems, and we may be the people to catch it, or we may be the people to help prolong their functional activities as long as we can. And I think it will be beneficial for them in the long run and their family.